Welcome to the AIAMC podcast. I'm Kimberly Pierceberg, Executive Director, and I'm so excited to be visiting today with some team members, team leaders from National Initiative 9 on the social and moral determinants of health. These particular members from Aurora Healthcare and Atrium Health, Aurora, of course, in Wisconsin, Atrium Health in North Carolina. Their projects were focused on climate change. And we found this really fascinating, and we wanted to learn more about those projects today. So, with me today from the Wisconsin Aurora Health are Dr. Deb Simpson, who's the Director of Education for Academic Affairs, and Dr. Ann Getzin, who's a family medicine physician by training and also the Medical Director of Sustainability for Advocate. Of course, Aurora is a part of Advocate, as is Atrium. And with me from Atrium Health is Dr. Levy, who's a pediatric hospitalist at Atrium Health Levine Children's Hospital. So members, welcome. I really enjoyed seeing your posters, your final posters at National Initiative 9 Meeting 4 in New Orleans last month. Atrium's project was entitled Healthy Climate, Healthy Lives through Onboarding Sustainability Exercise. And their aim was to make their residents and fellows real advocates for climate change. And Aurora had a similar project, but it went across the medical education continuum entitled Educating and Engaging Physicians in Eco-Friendly Healthcare. So I guess my first question would be the why. You know, when we think about why, what projects we pick, what content, it's always nice to start with the why. So when we think about social and moral determinants of health, I don't know that climate change would necessarily be the first thing to come to mind. So again, we find this fascinating and want to learn more about it. So can someone from the team share with me that why? Why was it climate change you wanted to focus on? Anne, could you get that one for us?
Sure, I'm happy to talk about that. I agree, climate change isn't always the thought that jumps into everyone's mind immediately when we start talking about social determinants or social drivers of health. But as you learn more and more about how rapidly changing our environment is and the dynamics behind that, including climate change, you come to understand how this is a threat multiplier. So,
Mm,
climate change drives so many different aspects of our environment. As our planet warms, we see more extreme weather events. We have changes in how the quality of the air that we're breathing is, from air pollution to more frequent wildfire smoke exposures, for example, or major floods coming from more frequent and extreme storms. For example, Hurricane
mhm,
Helene just last September affected a lot in our community. And so these shifting dynamics in our environment drive major exposures and health
mm,
outcomes for our patients. And we know that our most vulnerable communities, particularly Black and Brown communities, Indigenous communities, who are already facing many other
mm.
major barriers and challenges in their social drivers of health, we find these communities are also the ones that are most adversely affected by such exposures and have the least resources to develop resilience
Mm,
and protect themselves. A
mm.
lot of times we think about this as a future threat, but we're understanding more and more how these changes are affecting us here and now today. And so our goal is to help our health professionals understand that better.
Mhm. No, that's it's so true and it's so important. And as you have phrased it, it's not only that the problems are obvious, but then oftentimes they do affect our communities who have the least amount of resources and are more likely not to be able to have a positive outcome from that challenge. So good stuff. It's really healthcare medical education needs to embrace these ideas of climate change more. Did you want to add to that, Deb?
Yeah, actually, I think it'd be fun to hear Aaron add to it because he's got a pediatrician's perspective and
Hmm.
just went through a hurricane and everything else over in Charlotte.
Yeah.
Yeah, I mean, I think Anne said it, Dr. Getzin said it really well, that we can actually see in real time now our communities being affected from even in the healthcare system, our IV fluid shortage
Mm,
that was impacted by Helene. It doesn't just impact our patients, which is obviously extremely important, especially the vulnerable communities, but also our healthcare system at large. and really shows how we as a system can come up with quick and innovative solutions to address some of the impacts. For instance, our healthcare system came up with protocols and strategies to limit IV fluid use in a safe way. And we really showed that we were successful and were able to do that in a way that did not impact patient care, but at the same time, allowed us to work within the resources that we had at the time. And you think of these situations that come up, whether it be the COVID pandemic or Hurricane Helene, climate change is going to start impacting our patient populations at a system level more often. And we're already seeing that. So I think it's really important to start thinking about creative ways. Not only individual providers can start adjusting their practice and educating their patients, but also a system at large.
Yeah, I agree with you, Erin. Deb?
And I think the unique part about each of our project areas is that we had a focus on educating clinicians about these impacts, not just the sustainability and the tragic events like from Hurricane Helene, but there isn't an organ system that isn't impacted by all of these climate changes. And that's a Stanford Dean of Medical Education telling us that. And so we then looked locally in each of our settings. So while all of us are independent in terms of being ACGME approved, we're all our own separate sponsoring organizations, we did a quick what we call a climate quiz with our GME leaders across Atrium in Chicago for Advocate Healthcare and in Milwaukee for Aurora Healthcare. And the knowledge base just isn't there. Like you would expect those leaders to have some sense, for example, of what's the highest level of evidence associated with climate change. And many of them thought they were case reports or the lower level versus the systematic evidence-based reviews, which are out there and abundant. So it created a really good education gap for all of us. And then it was the fun of what we can do that's engaging.
Yeah, and I was really intrigued by the scholarly approach your projects took to this, because I think then that will speak to our medical educators, and that, you know, this is evidence-based, that the literature does clearly show. So that's a great segue from, we understand the why this is so important to do and where we are lacking in knowledge. So how did you do it? Can you talk to me about how you developed and implemented your projects and what initial outcomes you saw from that, and your plans to sustain this important work? So who wants to be the first one to tackle the how? Because I think we will all be in agreement. Yes, this is a very serious issue. But how'd you go about doing that? Do you want to tackle that first, Erin?
Yeah, sure. I think we were talking about those education gaps, and so it's about connecting the dots for our learners. And so we were trying to think about not only educating kind of passively, making sure that they just know the 101 of like, why does this matter? Kind of what we were just talking about. But then the next step, you know, the modern learner is an active learner, so we have to engage them somehow. And telling that story of, well, how does this impact people? Okay, well, that seems like really overwhelming and it's too much. And like, what can I do about it? And putting the ball in their court and saying, okay, here's what you could do about it. And so that's where we came up with the idea for this Shark Tank session at Resident Onboarding, a resident orientation in Charlotte, North Carolina. We're really fortunate there to have a community partner, which is really exciting to be able to engage with Envision Charlotte. They are stationed at this place called the Innovation Barn. Really awesome hub of sustainability that wanted to partner with our healthcare system and look to ways where we could tackle some of these challenges and look at reducing waste within the healthcare system. You know, the U.S. healthcare system contributes anywhere from 8 to 10%, it's been estimated, of emissions in the United States alone. If we were a country, we'd be the 13th largest country if we were just looking at the U.S. healthcare system alone. So that's a massive undertaking to look at how much pollution and emissions that we produce, and we're trying to prevent harm, but we're actually doing harm ourselves. And so having the residents look at solutions specifically, we provided them with a bunch of basically plastic from the operating room that included like normal saline bottles or basins that plastic that is just it feels like infinite within the operating room or in the hospitals, and we showed them examples of that. And they, along with our gurus at the Innovation Barn, we have like a plastics lab guru, were able to come up with creative pitches to basically pitch, like in a Shark Tank style, their best solution to turn that plastic, that hospital plastic, into something purposeful for patients. And they really kind of surprised me. They came up with some really creative ideas, everything from pill boxes to toys for the children hospitalized there, but also even adaptive devices or prosthetic pieces for patients with disabilities. And that was actually the winning solution. And so what's really cool about that is now we're looking into how to explore that further and how we can actually make that a reality. So the residents are really, the young learners are really awesome at coming up with some innovative solutions and creative ideas to really to tackle some of the problems that we've talked about already.
That is so impressive and does sound like a lot of fun. And you're tapping into how creative the residents are, and to capture that creativity before they're, kind of go through the whole program and get to be like us. And maybe we get a little jaded sometimes, or we get overwhelmed sometimes. So really to tap into that can-do spirit and creativity was such a smart way to go about it. And did you have anything you wanted to add to what Erin has shared?
Absolutely. I so deeply appreciate the actionable work that Dr. Levy is highlighting and is really core to finding your footing in the next steps, or the so what, as you learn about these large and very overwhelming changes on a global scale all the way down to a local scale. It can be paralyzing if you don't recognize, what does this mean for my work as a clinician? What does this have to do with me, right? And so first of all, I think in our process of looking at this initiative, is to name, that's really big. And so how do we drill this down into tangible, bite-sized bits that are digestible and actionable, and also connected to the work we are already doing as physicians and what we're learning about? And so that was a big driver behind the +1 approach that we've taken, where we can synthesize and integrate climate and health education into how is this relevant for the care of a patient with chronic kidney disease or heart failure? How does this impact your anticipatory guidance as a primary care provider in family medicine, and how you're educating and counseling your patients? And so bringing those tangible actions into what this means for your clinical care now is a big component of that +1 strategy, without overwhelming people, and help you recognize that there is something you can do about it. You can protect your patients, and you can teach them how to take good care of themselves as well.
No, I love that. That's such an important point. And through our initiatives, we always say, don't boil the ocean. Look, try to really drill this down. What can you do? Celebrate those small successes, build on them. And so, I mean, this is a perfect example of following that approach.
So, Kimberly, we perhaps want to change your analogy because we don't want to boil the ocean anymore.
This is true. We got to come up with a new phrase.
So we need a new one. But I think part of our strategies are all feasible. The Climate +1, what it means is add a slide, a article, a something to an existing talk. So it's not like shoving more things into a bucket that's already full and overflowing. It can be integrated and impacting every element that you teach. And then we also, again, in trying to connect with people and what do they need and what's the requirements, we finished up late this fall a maintenance of certification part 4 for our family medicine residents and faculty that we also described as part of, we had a cluster of projects where they really tracked how many patients did they talk to about climate and the impacts? And they were surprised at how receptive their patients were.
Mm.
That when it's about my health as a patient, and you're telling me about my kidney disease, or gosh, the wildfire smoke,
Mhm.
that's coming over from Canada, that
Mhm.
we're like, well, why are we getting this?
Mhm.
And you can't see downtown Milwaukee.
Mm.
What do you do?
Mm.
And so it's a way to help them think through and practice and gain confidence, just like you will in talking
Mhm.
about any other topic,
Mhm.
but with their
Mhm.
patients. And the
Mhm.
receptivity only reinforced that.
Mhm.
So we had a couple of things. I think the fun thing that sort of percolated up at about the same time, given we had some small startup pieces, was we advocated to be part of what is Advocate Health, the enterprise wide environmental action committee.
Mm. Mhm.
And they had no one doing education.
Mm.
And so Aaron and I stepped back really quickly and let Ann be the chair. But
Great
Ann, maybe you
colleagues,
want
yeah.
to, yeah, Ann, maybe you want to talk about that a little bit, because that's a building from the micro up to the macro, and what we in MedEd can do.
Absolutely. And I would say it was an incredibly inspirational process to be able to take a moment and look at this whole scope of these micro local level initiatives and projects that have taken place throughout our entire enterprise footprint across undergraduate, graduate, and continuing medical education, the whole continuum. And then those discussion and review of all of those helped feed the foundation of developing some core competencies that we said, hey, what do we want every physician coming through education within our healthcare system to understand? What are the nuts and bolts about how the environment it drives elements of health outcomes? What can we do to protect our patients in clinical action? And how does our work in healthcare impact the greenhouse gas pollution and emissions that are driving a lot of these changes? Because it's a multifactorial piece, can get very complicated quickly, and we wanted to bring that all down to the one-on-one, what should everyone know?
Mhm. No, it's absolutely wonderful work, and clearly the three of you and the teams that you led um, get it. They're doing the right thing. They're reaching the right people. They're making it patient-centered, and the clinician can put that language into when they're having a patient encounter. And I believe very humbly that you would have done this tremendous work even without the AIAMC National Initiative. However, um, if you wouldn't mind appeasing me just a tiny bit, we're about to launch our 10th national, actually today, we're making the announcement for our 10th national initiative. 18 years we've been doing this, these 18-month initiatives, and wonderful work that we love to highlight, such as these projects have come out of that. But we're also very aware about half of our members have never been in an initiative. So I'm hoping that other half, will listen to this podcast and be so inspired by the work you've done that they'll join us in 10. But I would just love to hear from you. How in some small way did the structure of the national initiative help you keep moving forward and help you ultimately realize the wonderful outcomes that you've shared?
Having been involved in other national initiatives, I think this, Aaron, might have been Aaron's first, but Ann has peripherally been involved as a participant in others. We always tend to look for work that we want to be doing and take to the next level, because there is an infrastructure that the national initiatives provide and expectations. You meeting one, you show up, you're all excited. I got to meet Aaron for the first time face to face. But then there is this gap when you don't see each other so much necessarily, because not all of the national initiative people come to the meetings, but it gives you requirements to fulfill and a timeline and a process and expectations. So And then the other is it gives a chance to dialogue with people doing similar work. So I think those, to your guidance, don't do everything. Pick some actionable pieces that you think you would want to do anyway and go for it. And then be agile. And try and think about where there's data, where there's a topic that would connect with people, and climate connected at a high level. But most of the people that participated on our various teams knew very little, with the exception of Anne and Aaron. But yet OB took over and ran with it and embedded it in their kind of M&Ms and case studies. And the person that did that learned as she went and moved that along. So I think it's finding that way and then using those to check off the box requirements for both your healthcare system. So this is a priority for our healthcare system and for ACGME and other accrediting bodies, because you get scholarly work, you get the opportunity to present outside. So it's a win-win-win kind of for us.
Yeah. Well, and what I especially appreciate that you touched on, Deb, is I think perhaps individuals who aren't as familiar with our national initiatives, they'll see the topic and think, oh, I don't know anything about that, or I wouldn't be, the right person to lead that. But as you just said, you don't have to be the content expert. You have to get a small group of people together that are passionate about doing something and figuring out what you can accomplish in those 18 months and have a plan to sustain it beyond that. So I appreciate that. Anne and Aaron, I don't know if either of you have anything to add before I'm going to do a quick lightning round of just some fun questions to get to know you a little bit better. But any other thoughts about the structure of the national initiative that was helpful?
Yeah, I can jump in. This was my first national initiative, so everything was new for me and a learning experience. I thought it was great to like kind of to feed off what Deb said, was to create that structure where was it exactly the same by the end of the project as where we started? Absolutely not. But that was kind of the fun of it. And it also brought in a lot of different people with different talents and different expertise that we were able to kind of blend into a really unique project that was ultimately, again, successful in its own way, not how we initially planned, but that was part of the kind of the adaptability of it, and brought in people that we don't think we would have otherwise, and really has already spurned some new projects going forward. So I think it's really given us that structure and formality to keep it going, because I don't think we would have been as regimented about staying on task, and it really did. It kept us moving forward, and I really felt like it was successful and productive. So yeah.
That's great. Thank you. We know those of you in medicine are overachievers. So, you don't want to be the only one on the cohort showing up without progress to report. So we tap into that. Anne, did you have anything to add?
I absolutely agree with both Dr. Simpson and Dr. Levy. Their perspectives are key on the framework, the structure, to keep a lot of excitement and ingenuity on tangible outcomes. And I think that framework is tremendous in moving those things forward.
That's great. All right. Well, I'm going to end with, as I foreshadowed, I think it's wonderful for our members and the medical education community at large to get to know you better professionally and to hear about the great work you've done. We also want these podcasts to be an opportunity to get to know you personally and just get to know you a little bit better. So because there's three of you, I just have one question each. So it'll be just quick, like I said, fun facts lightning round. And this isn't in the category of do you prefer? So do you prefer? Deb, Dr. Simpson, I will start with you. Do you prefer texting or talking?
Talking.
Oh, okay. That seemed easy.
Although I have learned now to use the oral part, so it is easier to text.
Oh,
The
okay.
microphone.
Talking to text. Yeah. Oh, I'd be lost without
But
that. That's for sure.
still talking. Yeah.
Yeah. Cool. Dr. Levy, how about you? Do you prefer salty or sweet?
Oh, 100% salty. I turned down a cake the other day. But if you have a
What?
bag If you have a bag of chips near me, even my
Look
daughter
out.
will say, "Daddy, you ate my snacks." Yeah, it's not even close.
Oh, well, duly noted. If we're at a conference with Aaron and they bring the snack tray out, it's going to be every man and woman for themselves.
I'll leave the chocolate for everybody else.
Okay. Sounds good. And then finally, Dr. Getzin, do you prefer the beach or the mountains?
Ooh, that is a difficult one. I am going to have to say the beach because of our beautiful proximity with Lake Michigan in Milwaukee. And I can have a part of that in my day-to-day life and appreciate the water and beauty of it all.
That's wonderful. Very awesome job, everyone. Well, I do give my most sincere thanks to Doctors Getzin, Levy, and Simpson for being with us today. I thank those of you who are listening in as well. I hope you do check out the AIAMC YouTube channel and see other podcasts that we've recorded. And if you haven't already, do follow us on social. We have presence on Facebook, LinkedIn, and Instagram. We'd love to have you visit us there as well. So thank you all and take good care.
Thank you.